Hello everyone, and welcome to this audio podcast. This audio podcast as part of a Hilium Space Edition or series. This audio podcast as part of a Calibrated Morphology, and this audio podcast as part of a Storm Robotics production. In this audio podcast, sort of following on from CKD or the sort of the underpinnings around CKD or chronic kidney disease. This audio podcast will go into look into some of the sort of the epidemiology, some of the epidemiology around hematuria. So hematuria is a relatively common common finding and has sort of many potential underlying causes ranging from the sort of physiological to the life threatening. The prevalence of hematuria on sort of urinary dipstick investigations has been studied in several or amongst several sort of population groups, such as patients, for example, attending hospital outpatient appointments, outpatients in occupational health programs, and also in sort of large medical insurance health screening programs, and has been found to range where hematuria has been identified has been identified in amongst a range to be found in around between 2% in around 2% up to just under 20%, and retrospectively investigations around hematuria using urinary microscopy shows sort of a prevalence of in around 1 to 5%. However, the laboratory reference range varies depending upon the definition of a significant hematuria. Now, what this means is, just to iterate, the laboratory reference range for example, laboratory services in one for example part of a country versus the laboratory reference range around hematuria in another, perhaps in this for example in either the same city or the same sort of region, or in versus for example elsewhere, the laboratory reference range around hematuria may differ, and this is down to the basis of where clinicians sort of implement or utilize guidelines to identify what is significant hematuria, um, significant sort of hematuria for and amongst the population that is applicable in the city or the region that they practice part of their sort of clinical works. So the laboratory reference ranges will differ, may differ a little bit, but the definition at the same time of hematuria generally, at least where terminologies are applicable, where terminologies around hematuria are applicable, SNVH and ANVH. So symptomatic non-visible hematuria, SNVH, or asymptomatic NVH, or ANVH are terminologies that clinicians with the clinicians would sort of utilize as part of works with laboratory teams in amongst laboratory bases where clinicians and laboratory specialists, for example, look to make decisions around recipients or patients who might present with either AMVH, SMVH, or amongst asymptomatic hematuria, but also where the cause of hematuria may be idiopathic as well, which is sort of an unknown basis for why sort of hematuria has been part of the etiology around particular parts of a patient's cause for a particular sort of nephrological or urological sort of conditions. At the same time, hematuria again may be idiopathic and or benign, or it can be a sign of the presence of a renal stone or kidney stone, or a tumor in the urinary tract. If white blood cells are found, white blood cells or WBCs are found in addition to red blood cells, then urinary tract infection, UTI. A UTI is perhaps the most probable diagnosis. Occasionally, the term hemoglobinuria is utilized to indicate a high red blood cell count or RBC count in the urine, although this may not be directly indicative again of hematuria specifically. At the same time, it is important to take a full sort of urological history, and include palpitation of the abdomen and BP. Examination should include sort of thorough investigation relating to features of potential renal involvement, including altered renal function. Again, sort of test investigations, proteinuria, known previous renal problems, renal mass, and increased hematuria. It is important to appreciate that hematuria without proteinuria does not necessarily again specify non-glomerular origin, as glomerular bleeding is not automatically associated with is not automatically associated with proteinuria. The as part of the sort of so as part of this as well, to highlight that whilst hematuria again can have a link with urology, can have a link with a sort of urology, and can have a link with nephrology. Now the sort of preemptive thinking around the underpinning, the sort of underlying basis of hematuria, historically or retrospectively, has been that there's nephrology involvement, nephrology etiology, where hematuria is concerned. However, the bladder or urology, in fact, urology, where at least in around where hematuria is concerned, is more probable than a nephrological a nephrological basis in initial investigations around hematuria. When once, for example, the significance of hematuria has been determined or identified, then nephrology teams or renal teams, for example, can then say that, for example, the hematuria is linked with a nephrology, or has a nephrology etiology as part of the underpinnings of why recipients or patients are present with a form of hematuria. So just to sort of iterate, I just wanted to sort of iterate that point, since there can be amongst the literature, there can be sort of differentiations in around the basis around sort of hematuria, sort of nephrology and urology. So just to iterate that point. So that draws this audio podcast to a close. This audio podcast has been part of a Hilium Space Edition and series, and this has been an audio podcast as part of a Calibrated Morphology, and this audio podcast as part of a Storm Lobostics production.